Prevention is a key to breaking the cycle of HIV transmission. In spite of the country putting in place strategies for HIV prevention, there has been an increase in the number of HIV infections, especially among adolescent girls and women. While such progress has been made to end the HIV epidemic, not enough has been done to reduce new infections. Adolescent girls and women, young women face the consequences of unprotected sex and bear a huge burden of unwanted pregnancy and the risk of HIV and AIDS infections. The current prevention options, which are condoms, PrEP, oral PrEP, treatment as prevention, voluntary medical male circumcision, HTS, and EMTCT, are highly medicalized with limited involvement of the community. Therefore, I commend the government for the efforts they are putting in place to fight HIV and AIDS, as we have seen people have access to HIV testing and treatment services. Thanks to the government for providing free life-saving drugs for people living with HIV. We have seen many new approaches that Zambia has put in place, such as adopting. We have seen many approaches the country in Zambia has put in place, which have adopted to ensure that people living with HIV have care to access medical care. For example, by providing month subscriptions of HIV medicines. Working together in solidarity, we can realize the sustainable development goals of ending the AIDS epidemic by 2030 and build a healthier, safer country for all of us. Once more, I welcome you and thank you to each and every one of you for being here with us today as we deliberate on the HIV prevention. Thanks very much.
Thank you very much, Mr. Question. That was Mr. Question from the Network of Zambian People Living with HIV. So give the welcome back. We are going to hear from a young person to deliver her speech. I call upon Moinya Shiti to give a speech before the question. So Moinya is going to speak on behalf of young people.
Thank you so much for this opportunity. Good afternoon, ladies and gentlemen. I believe protocol has been established and I will continue to ride on that. Thank you. So, I stand here on behalf of young people. We are concerned with the rise of HIV infection, especially amongst adolescents, girls, and young women. HIV still and continues to have a face of a woman, and this time around, a face of a young woman. The question that begs to be answered is, what's going on? Interventions to prevent HIV are in place, but infections are not reducing, and this is our concern. Let me touch on some challenges that young people are facing. Number one, lack or limited information on HIV, which contributes to young people having low risk perception when it comes to HIV. Number two, gender discrimination and violence remains high in this country, making girls more vulnerable. Number three, the community has not been supportive due to lack of information. Where there is lack of information, where there is lack of information, there is hostility. And that is the current situation in our country. As parents still deny that young people are sexually active. Point number 4. The HIV prevention options are offered at facilities where one needs to be ill in order to access them or to visit the place. The ART department where PrEP is offered is a barrier to access. Number 5, negative attitude from the healthcare providers are not only negative, but judgmental. When it comes to accessing services such as condom and PrEP as an option, has been stigmatized, especially for serodiscordant and sex workers. Number 7, absence of HIV prevention community structures. There is no community-driven structures to anchor prevention aspects and interventions borne by the community itself. Point number 8, lack of negotiation power for safe sex among adolescent girls and young women to allow them to protect themselves confidentially, thus freeing the woman from relying on a man to always wear a condom. We know that the country has put strategies to prevent HIV, such as VMMC, condom programming, PrEP, and HIV is still on the rise. We note with great concern that HIV prevention interventions have not been designed with a young person in mind. Young people have limited involvement or say in the design and implementation of these programs. How young people are involved and reached is very important. Without their involvement, we will not win this fight. There are many programs that are designed and funded, but do not speak to the needs of everyday life of a young person. You need to listen to us. You need to consult us so that we tell you what we want, what we need, and not what the money dictates. We would like to see an expansion of HIV prevention options that are available and accessible to young people, giving us more prevention options that are tailored to our needs, which are user-friendly, discreet, long-acting, which is a big step in attaining epidemic control. We therefore wish to submit some of our admissions and what we request to see. Number 1, we need condoms that can be accessed at the most convenient, at our most convenience and not just the health facility. We still continue to cry for that. PrEP should move from ART department to the community and integrated in other services. We want a new option like DVR, which we are all calling the name, to be rolled out easily and accessible. If possible, let the woman insert it herself. Our last point, our last recommendation. We look forward to a time when we can have injectable PrEP that offers protection for those that can't use the available options. In my conclusion, we are calling on the government to roll out new HIV prevention options such as the ring. We also want to see that HIV prevention is demedicalized. How's HIV prevention from the hospitals to the communities where infections are happening? Invest in local community structures. Thank you.
Thank you very much, Mwenya. That was the voice of the young person speaking on behalf of young people. I'll now call upon Mr. Fortune Chibamba Director of Programs at the National AIDS Council to give a few remarks, as well as call upon the guest of honor, Professor Laxon Kasonga.
Thank you very much, moderator. Mine is a very, very short call. But before I call upon the Permanent Secretary to submit his address to this meeting, I just want to sincerely thank you, Tao and MZP Plus, for organizing this meeting. This is a very good platform for us to introspect, for us to question ourselves, where are we coming from with regards to the HIV response? Where are we and where must we go? I think from the discussions we've just heard from the young people, their concerns, giving us an insight of what it is that we need to do. And a lot of people have also submitted on what they think must be happening. But for me now, I just want to call upon our own Permanent Secretary to put up a word and address this meeting. Permanent Secretary.
Thank you very much, Mr. Swamba. Probably let me remove my mask, and I do hope that members of the press don't make a big story out of this, stating that it's the guy that is always telling everybody to wear masks in all public places, and there he is speaking without a mask. I stand here this afternoon to represent the Honorable Minister of Health, Honorable Senator Masabo, who would have been extremely happy to have been part of this very important gathering. But on our way to hear from home this morning, she found herself in a road traffic incident that precluded her from traveling further to come here. She had to go to the hospital and get some treatment. And she's back home right now, taking a rest. She brings greetings to all of you, and I assure everyone that she's fine and causes no big cause of concern from all of you, and encourages all of you to participate and go along with this program. I want to thank all of you for finding time to come here this afternoon, since morning, to interact and create this dialogue. I particularly recognize the presence of the Director of Programs at the National AIDS Council, Mr. Chilamba, my directors from the Ministry of Health, who are here to support this very important gathering, the National Director, the Treatment Advocacy and Literacy Campaign, TAO, and the Executive Director for the Network for Zambia People Living with HIV, for putting up this very important meeting. I also recognize all of you, the young people, the older people, and everyone of you that came out to this very important meeting. And of course, not forgetting the members of the press that are always with us to disseminate all the important information that we need to share among ourselves as members of the public. And so I'm extremely delighted to be here this afternoon and fit into the Minister of Health's position to officiate at this HIV prevention dialogue under the theme, "Are we on track to achieving epidemic control?" This is a wonderful theme. In itself, it's a statement, but it is also a question. The meeting would not have come at a better time than this, when the country is experiencing an increase in HIV infection. I wish, therefore, to commend the partnership of the Treatment Advocacy and Literacy Campaign, TAO, and the network of Zambian people living with HIV, NZP+, for organizing this very important meeting. I note that we have a multi-sectoral representation of stakeholders in this room that brings together a diverse pool of expertise. This stakeholders' engagement has been discussing the current HIV prevention situation in Zambia, including challenges and lessons learned. Further, we need to build consensus on the way forward, which I believe should emphasize the importance which HIV prevention has in eliminating the HIV pandemic in our country by 2030. The Ministry of Health regrets the high HIV prevalence in our country. Preliminary results from the Zambia 2020 indicate that the prevalence is at 11%, which is still in double digits. As a ministry, we are concerned that despite the country having strategies on HIV prevention in place, there's still an increase in the number of new HIV infections, particularly among adolescent girls and young women. While much progress has been made to end the HIV epidemic, not enough, unfortunately, has been done to reduce new infections, especially among the adolescent girls and young women. Apart from the risk of HIV infection, adolescent girls and young women face other consequences of unprotected sex, such as unwanted pregnancies. Questions that beg to be answered are we doing enough? If so, where are the gaps? What can we do different? It is also important for us to remember that there is a generation of young people who were born after the horrific scenes that characterized the initial phase of the HIV pandemic, particularly the early 80s, before the advent of the antiretrovirals, because it became widely available. These are not safe as long as HIV is still with us. For this reason, we need to amplify on HIV preventive measures. We need to raise public awareness on the HIV burden, access to HIV testing services, and other virus HIV preventive measures. This should especially focus on those most at risk, such as adolescents and other priority populations, as well as marginalized populations. This will give the program the necessary thrust in accelerating the reduction of the new HIV infection and in decreasing the HIV prevalence towards a single digit. There is need, once again, to go back to the community initiatives that remain relevant and play a critical role in HIV response. We need to rethink the current prevention interventions that are mainly biomedical with limited involvement and participation of the community. I'd like to re-emphasize on the important need to medicalize HIV that I heard about when I stepped into the home during the discussion dialogue. That we need to apportion responsibility to the community to take the HIV agenda, particularly with respect to prevention, to the community. And it's through that effort that we should see a change in the HIV scale. Granted, as Minister of Health We've taken center stage in HIV fight regarding treatment, but we do strongly believe that prevention efforts can best be carried out by the communities where we all live. Reducing new HIV infection means addressing the social and legal barriers that impede many people, especially the adolescents and young women, from accessing HIV services. It means tailoring prevention programs so that the right services reach the groups that are most vulnerable and affected, ensuring that individuals have easy access to approaches that are socially and culturally appropriate and work for them. Therefore, there's need to invest in strategies that have a greater impact. Although attention to HIV and AIDS remains strong, particularly in relation to HIV treatment, HIV prevention has received minimal attention. Treatment alone will not reverse the epidemic. HIV prevention is the bedrock of epidemic control, and current prevention efforts have not been successful in thwarting HIV transmission. As a ministry, our HIV prevention focus in 2022 lies in primary prevention of HIV, including emphasis, once again, on abstinence and condom use, HIV testing, elimination of mother-to-child transmission of HIV, syphilis and viral hepatitis, expanding knowledge and access to PrEP, and reducing STIs. The UPND government is committed to ensuring that HIV prevention efforts are decentralized and that there's greater involvement of communities with matching resources in order to yield the expected results, like I've said before. We are open as a ministry to listen and take forward recommendations from this meeting. Once again, I applaud TAO and NZP Plus for organizing this meeting. This is an open dialogue that I do hope will bring out honest discussions as to where we are and where we want to go. We look forward to hearing suggestions on prevention efforts that reflect and address social and structural complexities that are related to HIV prevention programming. And on behalf of the Honorable Minister of Health, it is now my distinct honor and pleasure to officially open the 2022 HIV prevention dialogue. I thank you all, and God bless you.
Thank you so much, Professor, for the keynote address. I'll now ask Mr. Trevor Shirende from TAO to give a vote of thanks.
On behalf of TAO and NZP+, I would like to thank the Minister of Health, Honorable Silva Masero, MP. I also want to extend my thanks to Professor Lakson Kasonga, Permanent Secretary in the Ministry of Health. And also I want to thank Professor Lloyd Mulinga, the Director of Infectious Diseases in the Ministry of Health. And also Mr. Chibamba from National AIDS Council, the Director Programs, for coming to officiate at this function. We've heard that your doors are open for us to come and interact with you. And I should assure you that we shall follow up on the recommendations that we've made to ensure that we see how we can move this program forward. So thank you for coming, and I know that you're a busy person, but you've taken time to come and be with us. Thank you very much.
Thank you, Mr. Pema for the vote of thanks. We are going to break off for lunch, and thanks the president to bring us for lunch, and we will reconvene at 14:30 for the second part of the program, so that we come up with a consensus and recommendations for moving forward. Thank you very much for welcome.